Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before I get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been used. We can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which I'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. So today, I have the pleasure of introducing you all to Dr. Sanchita Singal Parulkar. She is a cardiologist at Massachusetts General Hospital. She is a member of the Corrigan Women's Heart Health Program, as well as an instructor of medicine at Harvard Medical School. Her interests within cardiology include medical education, women's heart health, echocardiography, and nuclear cardiology. She is a member of the AOA and GHHS and serves on the American College of Cardiology's Program Directors and Graduate Medical Educators Council. In recognition of Heart Month, she joins us today to give a talk on heart disease. So please join me in welcoming Dr. Singal Parulkar.
Thank you so much, Amy, for that kind introduction. I am just going to share my screen. Are you able to see my screen? Perfect. It is a pleasure to be speaking with all of you today, especially during the month of February, which is Heart Health Month. The purpose of today's talk is to raise awareness around heart health, since cardiovascular disease is the leading cause of death in the United States. And on that note, I'm going to get started with my talk, which is called Heart Disease, What You Need to Know. This talk will include an overview of the following topics. We will start with talking about the heart as an organ, factors that affect heart health, strategies to improve heart health, when to seek further evaluation, some myths versus facts as it's related to cardiovascular health, resources for patients and their families, and then there will be time for a question and answer session as well. So let's start with talking about the heart. The heart is an amazing organ that works as both a mechanical pump and electrical circuit, and in doing so, distributes blood throughout the body. Heart disease is a broad term that can refer to issues within the various components of the heart. It can be related to issues of the anatomical or structural components, or it can be related to issues within the electrical system of the heart. And so, taking a closer look at the heart, let's look at some of the anatomical and structural components. So here you can see an image of a heart model, which you may find in your cardiologist's office when you go for a visit. The heart consists of structures and components such as the coronary arteries, which are the blood vessels that supply blood flow to the heart. It consists of valves, which control the flow of blood through various chambers within the heart. The heart consists of various layers of muscle and tissue, which are given the names epicardium, myocardium, or endocardium, based on which portion of the heart they are found in. The heart sits in a protective, double-layered sac that is called the pericardium. And of course, as I mentioned previously, there is the electrical conduction system of the heart as well. And so issues with either the structural, anatomical, or electrical components of the heart can all broadly fall under the term of heart-related disease. And issues within any of these components could be a reason for you to see a cardiologist. Now, there are quite a few factors that impact heart health, and I've included some on this slide. These factors include age, gender, family history and genetics, other medical conditions, which sometimes you may see referred to as comorbidities, and these include factors such as blood pressure, cholesterol, diabetes, habits and behaviors. So, things such as exercise, sleep, alcohol consumption, whether or not someone smokes, and nutrition. And so I created this graphic on the right side of the screen here. And here you can see that some factors on this list you can't really modify, right? Can't really change your age, can't really change your family history or genetics. But there are certainly some on here that you can modify, such as your habits and behaviors and your nutrition. And so, since the purpose of this talk is to provide education on heart health and ways to optimize the ability of the heart to function effectively, let's delve a bit more into the factors that you, as an individual, can influence and improve to optimize your heart health. So some parameters that one can focus on optimizing include blood pressure. So really, we say that a target goal for blood pressure should be a reading of 120 by 80 millimeters of mercury, where 120, or the top number, is referring to your systolic blood pressure reading, and the 80, or bottom number, is referring to your diastolic blood pressure reading. And I've actually included a graphic from the American Heart Association here that characterizes blood pressure based on whether a reading would be considered normal, elevated, or in the high blood pressure or hypertensive range. Another parameter that is very important to think about and have within good control is cholesterol. And so here I've included some general cholesterol goals for individuals to be mindful of. So typically we want total cholesterol to be around 200 milligrams per deciliter or less. We want low density lipoprotein, which sometimes colloquially you'll see referred to as the bad cholesterol, to be 100 milligrams per deciliter or less. And in individuals who are deemed as having very high cardiovascular risk, that parameter is actually 70 milligrams of deciliter or less. In individuals, so that's low density lipoprotein. When it comes to high density lipoprotein, which is colloquially referred to as good cholesterol, the range for this can actually vary based on whether you're a man or a woman. And typically the general range here is 40 to 60 milligrams per deciliter. And then triglycerides, which are another component of your cholesterol, you want the target for that to be 150 milligrams per deciliter or less. Now, of course, I don't expect you to memorize any of the parameters I've listed here. These are just as general guidelines for you to know that where your cholesterol targets should really be. And here I've included a graphic from the American Heart Association, which shows actually a close-up of your coronary artery. So there's a magnifying glass right over here, which then brings us here to the coronary artery. And as you can see here, there is a yellow circle here that is indicating the initial formation of cholesterol depositing or starting to form plaque in the coronary arteries. And that view is zoomed in over here, where basically it's showing that LDL is depositing cholesterol between the layers of the artery wall. And so this can actually grow over time and cause areas of narrowing and blockage, which in the medical world is given the term atherosclerosis. And this is why we have these cholesterol goals and parameters that we set for patients and advise patients to follow, because this is actually the process that we are trying to prevent as much as possible from happening. You know, on this slide, I've presented blood pressure and cholesterol as parameters to optimize. But it's important to note that if for some reason your blood pressure was too high or not well controlled, the term for that medical condition would be called hypertension. And if your cholesterol was too high or not controlled, then the term for that would either be hyperlipidemia or even the term dyslipidemia. And so You may have heard these terms being used, whether when talking about, your health-related matters among your family and friends. And so that's what those terms are really referring to. And so, thinking about these parameters early on is important. Optimizing them, taking steps to optimize them is very important. And then let's also talk about another medical condition that is very important to take care of, especially if you're trying to, focus on optimizing your heart health. And that medical condition is diabetes. Diabetes is a multi-system disease that impacts various organs of the body. And good blood sugar control is key when it comes to diabetes. And so typically we use a metric called a hemoglobin A1C target. And we say that for people with diabetes, we really want that target to be 7% or less. And so one way to think of hemoglobin A1C is like an average of your blood sugar over the last 3 months, and is reported in the form of a percentage. And I also tell individuals with diabetes that it's important to do frequent blood glucose monitoring and to be on appropriate medication therapy. That can either be in the form of oral medications and or insulin therapy based on, where their sort of hemoglobin A1C and blood glucose range is. And I often get asked by patients that, well, what really is the connection between diabetes and heart health? I'm not really following why high blood sugar would be impacting my heart. And so I tell patients that one way to think about this is that high blood sugar can cause damage to the walls of blood vessels all over your body. But if we specifically want to talk about the heart right now, we will say that, it can cause damage to the blood vessels within your heart. And that can lead to inflammation and the promotion of those atherosclerotic plaques that I talked about a few slides earlier, which over time can accumulate and then cause narrowing and coronary artery disease. And so that's why it's very, very important to be mindful of these parameters, to be mindful of these medical conditions, and really to do one's best at trying to optimize them as much as possible in order to promote one's heart health. And from here, we will now move on to habits and behaviors. And so let's start with sleep. Sleep is an essential component of one's health. It has been associated with healing and the repairs of cells and tissues. It's been associated with promoting a stronger immune system and also with improved mood and energy. And so really, adults should aim for 7 to 9 hours of sleep every night. And it's important really to focus on sleep hygiene and ensuring that you're able to, maintain certain habits and ensure that you're able to get this recommended a number of hours of sleep a night. And with that, I usually advise people to try limiting screen use around bedtime in order to promote sleep hygiene. Physical activity and exercise is another habit and behavior that's very, very important for one's cardiovascular health. And consistency is key here. So some parameters and guidelines that I give patients when it comes to physical activity and exercise are the following. I say at least 150 minutes per week of moderate intensity exercise. You can think of this as brisk walking. When it comes to moderate intensity exercise, I tell individuals, think of it as an exercise where you may still be able to talk, but you'll be slightly out of breath. So an example of that is brisk walking. Another parameter I tell people is if instead of thinking of just moderate intensity exercise, you can also focus on doing 75 minutes per week of vigorous intensity exercise instead. And that includes an activity such as running. So you can think of that more as an activity where you'll be breathing more heavily when working out, and therefore talking might be challenging. Another habit and behavior that's important to focus on is stress, how one copes with stress and stress management. And so, as we know, stress can cause physiologic changes in the body, and this can be in the form of stress that is physical, mental, or even emotional. And let's face it, stress happens in life, and you cannot always prevent it or avoid it from happening, but you certainly can work on techniques for how you respond to stress. And that's really what I advise people when I talk about stress management. And these techniques include activities such as mindfulness, meditation, and yoga. And similar to what we had just talked about on the prior slide related to sleep and physical activity and exercise, this is also an active step that one has to take in order to be able to function better within one's life, but also to, be thinking about one's heart health. Alcohol consumption. We know that excessive use of alcohol can negatively affect your blood pressure. It can negatively affect triglyceride levels. It can negatively affect the pumping function of your heart. So a term referred to that you may hear referred to as causing heart failure. And that alcohol can also cause something called cardiomyopathy, which you can think of as being an enlarged and diseased heart. I also tell patients that they should avoid smoking. Smoking is not good for one's heart health. And so if you don't smoke, that's great. Please don't ever start. And if you do smoke, it is very, very important to quit. Here, we can now speak about nutrition. It's important to have an increased intake of vegetables, nuts, whole grains, and fish. It's important to minimize salt intake, to minimize the consumption of processed meat, minimize consumption of refined carbohydrates and sweetened beverages. I advise patients that really they should select lean protein sources. These can be plant-based options, such as beans, lentils, tofu, and they can also be animal-based options, such as chicken, turkey, and fish. I tell patients that you should think of your plate being very colorful because you want to indicate that you're consuming a variety of foods and nutrients. And that's one way to sort of check, is your plate colorful when you're sitting down to eat a meal? And it's also important to remember that processed foods often contain hidden salt, so it's better to opt for fresh, whole foods. Another component of nutrition is portion control. And so this is important for supporting healthy weight management, for preventing overeating, for encouraging mindful eating. And so there are a few implementation strategies for how to make this happen. So I usually tell individuals that, think of filling your plate as follows. And here's a graphic actually from the USDA that does a good job of providing a visual representation. Half of your plate should be filled with fruits and vegetables, a quarter with grains, and about a quarter with lean protein. Using smaller plates can also help with portion control. I also advise individuals to read nutrition labels because those can help you understand portion sizes for different foods and make you aware of guidelines. And I tell individuals to pre-portion their snacks and to avoid eating straight from the package. Because if you don't measure the portions, you can lose track of how much you're eating. And now that we've discussed factors that impact cardiovascular health, let's talk about some strategies to improve heart health. It's very important to remember that small, consistent lifestyle changes add up over time and can make a big difference. And early detection and management of risk factors is key to the prevention of heart disease and optimization of one's cardiovascular health. I say one good step to start with is awareness. Awareness not just of what heart health is, but also of your own family and personal medical history. Then it's important to modify habits and behaviors as it relates to ensuring that the blood pressure is in a good range, that you're checking and managing cholesterol levels at routine intervals, that you're limiting alcohol consumption, that you've quit smoking if you used to smoke, and that you're working on achieving and maintaining a healthy weight, both through a combination of diet as well as exercise. This, as we just mentioned, ties into physical activity and the heart healthy diet. Of course, stress management is important, as we've talked about. And it's also very key to go for routine health checkups. So regular visits to your healthcare provider to monitor key heart health indicators, such as blood pressure, cholesterol, blood sugar, weight. This is all very, very important and all part of the overall strategy of ensuring that you are thinking about and working towards improving your heart health. And of course, there are times that you will need further evaluation. So it's never too early to start thinking about your heart health. Routine checkups with your primary care provider are important, where you discuss your individual risk factors for heart disease and that you work together to create a personalized prevention plan. And it's quite possible that based on this discussion, you may be referred for evaluation by a cardiologist. And so situations in which further evaluation by a cardiologist may be indicated are for the following reasons, which I've included on this slide. If you're having chest discomfort, if you have a heart murmur, if you have an abnormal heart rhythm, if you have cholesterol disorders, if you're experiencing shortness of breath, if there's a strong family history of heart disease, if you've experienced syncope, which is a transient loss of consciousness. And in addition to all of this, you can also see a cardiologist for preventative cardiovascular care. And so the initial conversation with your healthcare provider is key to determining the next step and how to move forward. And it's very, very important to be proactive about your healthcare because it's really important to ensuring that you are prioritizing your health and that also that you're thinking about your heart health throughout your life. And so at this point, I'd like to take some time to dispel some myths related to cardiovascular health. And so the first myth that you may hear is that heart disease only affects older individuals. This is false. While it is true that cardiovascular disease risk increases with age, heart disease can occur in younger individuals as well, especially those with uncontrolled risk factors. And these uncontrolled risk factors include factors such as uncontrolled blood pressure, uncontrolled cholesterol, uncontrolled diabetes, individuals who are smoking. And so heart health awareness and adjustments of habits and behaviors early on is key. On this slide here, I've brought back a graphic that we discussed about earlier in this presentation to indicate that there are habits and behaviors that one can work towards modifying and improving, and therefore heart disease is not something that just affects older individuals. The next myth that you may hear is, someone saying that, well, I have a strong family history of heart disease, so there's really nothing that I can do to change that. This also is not true. While heart health is impacted by family history and genetics, lifestyle modifications are also very, very important, and healthier habits can help reduce your risk. Now, another myth, which you can almost see as being perhaps an opposite view to this myth that we've just discussed, is the following. This belief that, only individuals with unhealthy lifestyles develop heart disease. This also is false. Yes, heart disease is impacted by lifestyle choices, but it is also impacted by family history, genetics, and other medical conditions, such as the ones that we've discussed previously. And so on this graphic that I've included here, you can see that cardiovascular health is almost like a seesaw between modifiable and non-modifiable risk factors. And that's why it's very important to have this discussion with your healthcare providers early on to determine what are the individual factors that play into your particular case and what should be the next steps from there in terms of prioritizing and focusing on your cardiovascular health. And so, as I said, routine checkups and conversations are key here. Another myth is that, well, if you don't have high cholesterol, you don't have to be concerned about your heart health. This is not true. Uncontrolled cholesterol is, of course, a significant risk factor for heart disease, but other factors also contribute, as we've discussed previously. And so a comprehensive approach to heart health is very, very important so that you can then develop an overarching approach from there. And so here I've included an infographic from the American College of Cardiology, which includes some cholesterol-related education on what is cholesterol, what are the causes of elevated cholesterol, and ways to manage it. And there are other infographics like this available on their website as well. And the last myth that I will address today is this belief that heart disease affects men more than women. This also is false. Heart disease is the leading cause of death in both men and women. In fact, women may experience different symptoms than men, and this can sometimes mean that heart disease in women is not recognized as early on as it might be in men. And there's actually now emerging data and studies related to understanding these differences, and also to raise awareness of how heart disease can manifest in women differently from men. And the reason that I brought up these myths and dispel them with facts is because these are common misconceptions that individuals have related to cardiovascular disease. And it's important to know that it is not such an absolute picture, that there are other factors that go into place as well. And that's why a conversation with your healthcare provider is very, very important. Patients also ask me, are there any resources where I can learn more about heart health? And so I've included some websites here that provide educational materials, infographics, and heart health tools for patients and their families. Each of these websites here can tell you more about heart health, the management of factors contributing to one's health and one's risk of cardiovascular disease. And here are some infographics and images from these websites directly. So the first resource here I'd like to mention is the American Heart Association. So here I've included a graphic from there which talks about 10 ways to improve your heart health. The Centers for Disease Control and Prevention is also another great resource. And as you can see here, because we mentioned that February is Heart Health Month, each of the main pages on the websites right now have a focus on this when you go onto their websites to log in. And the National Heart, Lung, and Blood Institute is also another excellent resource where you can find fact sheets, video resources, and health education resources as it relates to heart health. And I really encourage patients and their family members to use these websites as a starting point to learn more about cardiovascular disease, heart health, and ways to optimize one's heart health and to start that conversation with their healthcare providers early on. And so at this point, I would like to thank you all for listening to this presentation, and I would be happy to answer any questions from the audience. Thank you.
Thank you. We are now at the end of the session. If you have any questions, feel free to enter them in the chat. Dr. Singal Parulkar, we have a question regarding diet. I know you covered a little bit on it. Do you mind expanding more, providing more information on what types of fats and foods in our diet have the biggest impact on lowering our cholesterol?
Yes, absolutely. And I would say that this is a great discussion also to have when you go see your primary care doctor, even a cardiologist. I tell individuals that, you'll often hear that a Mediterranean diet is key. And so individuals often say, well, what does that exactly mean? And so the reason that I actually included the link to the American Heart Association is that they actually have like visual representations of what sort of fats to think about when it comes to a heart healthy diet. The way that I tell individuals is that not all fats are equal in terms of their impact on the heart. There are certain fats that are helpful for heart health, and that can help, reduce LDL, which is, again, sometimes referred to as the bad cholesterol, and increase HDL, which is seen as the good cholesterol. So, those include unsaturated fats, and those are foods found in foods such as olive oil, avocados, nuts, and seeds. Also, polyunsaturated fats have been studied as having like anti-inflammatory properties that can help reduce the risk of heart disease. These are also very good for lowering triglycerides and reducing inflammation. And these include things such as certain fish like salmon, walnuts, flax seeds, chia seeds, sunflower seeds. But again, sometimes when you're explaining this to patients, they can be like, well, that's really great to know, but I'm not going to remember any of this. And so usually I advise patients to go to the three resources that I mentioned there, where you can actually have a visual representation of some of these, foods that I talked about. And so So those are, sort of the good fats. And then in terms of the not so great fats, where I usually encourage patients to limit their intake, are the saturated fats, because they're generally associated with increasing your LDL cholesterol. And so these are, again, the processed meats, like I talked about, avoiding processed meats. I usually tell individuals that if they have a diet that's very heavy in red meats, that's also not something that's ideal. And again, it's all about sort of striking the balance between the two.
Thank you. And you provided some excellent resources towards the end. For anyone who's interested, as I mentioned, this session is being recorded. You can always visit our website at massgeneral.org/Blum-Center. It'll be up, I would say, within a couple of weeks. You can always refer to the recording for the slides. But if you're interested, feel free to email the Blum Center, and I'd be happy to share that list of resources with you. And it's pflc@partners.org for our, which essentially stands for Patient Family Learning Center. We have a question regarding fish oil. Can fish oil supplements help lower our cholesterol?
So I usually tell people that, when it comes to matters of, right, fish oil supplements contain the omega-3 fatty acids in them, right, as we talked about, which are beneficial for heart health. I usually advise people that if you are able to obtain this from your diet, that's probably better than just, taking a supplement. If for any reason you can't obtain this from your diet, then yes, of course, it's fine to take the supplement. But my approach is typically try to get it from your diet through the use of whole unprocessed foods. And if for any reason you're not able to, then yes, of course, the supplements are fine. Of course, we know that the omega-3 fatty acids are good for, lowering your triglyceride levels, and, have a good impact in terms of promoting heart health. But I wouldn't say that, if you can get it from your diet, that's better. But if you can't, sure, the supplement's fine.
Thank you. Can taking an aspirin daily help reduce our risk of heart disease? If so, what would be the recommended amount?
That is a great question. And the guidelines on this have actually changed in the last couple of years. There was a time where it was advised that individuals take a baby aspirin, which is aspirin 81 milligrams daily for primary cardiovascular prevention. And that is no longer actually the recommendation. And so it's not, so unless you have, some type of proof of having atherosclerosis or coronary artery disease, typically individuals will not be started on a baby aspirin. That being said, when it comes to cardiovascular health, heart health, one's individual risk factors, it often has to be like a risk-benefit discussion. We do know that there are certain populations of individuals that are at higher risk for cardiovascular disease. And so sometimes based on those risk factors, we can have a discussion about whether or not it would be appropriate for them to be on an aspirin. But overall now, it is no longer a recommendation for individuals to be on aspirin 81 milligrams for primary prevention anymore. You have to have some evidence or proof of having had some type of coronary artery disease to be on it.
Thank you. What are some questions we can ask our doctor about our risk heart disease? Just general questions.
One point that I will make related to exercise, when we were talking about exercise, because usually when I give the recommendation of 150 minutes of moderate intensity exercise and 75 minutes of vigorous intensity exercise, I sometimes have had patients say, oh, well, that's a lot of time. But I say, look, that's during the week. And if you want to give yourself the weekend off, if you just divide that, by 5, it's not that much time. And so that's one way sort of to think about it, that you don't have to think you have to do this like 7 days during the week. That, it's really just 15 to 30 minutes of exercise 5 days a week, depending upon whether you're doing moderate intensity or vigorous intensity exercise. So that is one way in which I like to encourage my patients to incorporate physical activity into their day-to-day routine, because it can be very challenging to do that in the beginning, especially if you don't have a regular routine. And I do say it'll be hard in the beginning, but then it'll become a part of your lifestyle. And so that's one point I wanted to bring up again.
For those who live in New England with the cold weather, do you have any recommendations on how one can stay active?
Yeah, that's a great point. That's a great point. So I usually tell people in those cases, of course, certainly it's very hard. Sometimes individuals happen to have, some equipment at home, whether it be a treadmill, a stationary bike. I encourage them to use it at that time. But really, I would say that, if you have someone else at home with you, I encourage you to find a buddy, whether it's a family member or a neighbor or someone, because that kind of helps you stay motivated. You talked about the weather and not being able to go outside. True, it's very challenging in the wintertime here in New England, but there are things that you can actually do at home also. You just need to have a little bit of space. So jump rope, right? You could technically jump rope in your house. And also like an activity such as like using a hula hoop, because really it's all about just getting your heart rate up. You don't necessarily have to be outside for that. If you really wanted, and I actually have had some patients who've done this, you can brisk walk from one end of your house to the other too. It probably will get very boring, but it is certainly something that you can do. But really, it's about just trying to get your heart rate up. So you can even walk up and down your stairs if you wanted to. Again, it's not fun, but if these are the limitations we're working with the weather here in New England, these are ways in which you can still find time to do your exercises.
And I have noticed a mall is a good option too for those who want to
That's
get out the house.
That is true. The only thing I would say though is if you get busy with window shopping though, then you won't be keeping your heart rate up. So as long as you're motivated to keep that, intense period of 15 to 30 minutes of either brisk walking, because it's probably not okay to run in the mall, then that's fine. But if you're going to say, oh, well, I just walked an hour looking at all of the stores here and there, then well, it's good. I'm glad you're walking, but I wouldn't put that in the moderate to vigorous intensity exercise range.
I agree.
Yeah.
But I do find that early before like right when they open, when it's
Yeah.
quieter,
Yeah.
that would be like a good option.
Yes, exactly, exactly, exactly. That is very, very true. Very, very true.
All right. Well, we see if we have any additional questions in the chat. Do you have any final thoughts you'd like to share with the audience?
Well, I did want to say that, as I mentioned, it's very, very important to go for routine, regular checkups with your primary care provider. And it's just important to start these conversations early. I always think that prevention and being aware is always a great step. Of course, in healthcare, if an issue comes up or a medical condition comes up, we have ways of managing it and addressing it. But being proactive and thinking about it is always good, because then you can get ahead of it. And so I would say it's never too early to start having these conversations, both with your primary care provider or in discussing it with a cardiologist. So that's really what I would encourage patients to do. Sometimes there are individuals who may not want to have the discussion because they might be worried about, well, what if something is discovered? And so I always tell people that it's actually, if something is discovered, then it's a good thing that you addressed it early on because you know how to approach it. But I do understand how that can be stressful or even anxiety provoking for some people. But I think, having those conversations early is important. So that's all I wanted to say. Start thinking about it early.
Absolutely. And what are some general questions would we ask our doctor, our primary care doctor?
Absolutely. So starting with some of the parameters we talked about, of course, when you go to see your primary care doctor, they check your blood pressure. There's often, they look at your weight trend. And they also do your cholesterol screenings at routine intervals. And so I think that's a great starting point to be like, look, are these all within normal limits? Is there something I should be concerned about? Are there any lifestyle modifications or even medications that I should think about potentially starting? And then having a discussion about your family history. And typically these are routine sort of discussions that happen when you establish care with a primary care doctor in your initial visit. But it's always good to sort of bring these up even in your follow-up visits with them. And then if there is a family history and if there are certain, parameters or risk factors that are not within control, then it might be worth to be like, look, should we manage, like, do you think that I should seek further evaluation with a specialist? What should be our plan for how to address it and to take it from there? But I would start with blood pressure, routine blood tests, and then family history, and then take a tailored approach from there.
Thank you.
Mm-hmm.
I don't see any additional questions in the chat, so I think it'd be fine to end a few minutes early. Dr. Singal Parulkar, thank you so much for spending the hour with us. This is extremely helpful.
Of course, absolutely. It's my pleasure. Thank you so much, Amy, and to the Blum Center for having me here. And I hope everyone has a great rest of their day.
Thank you. And thank you everyone for joining us today. Take care.
Thank you.